changes.
All right, and so we are here again, and I did tell you earlier that we are going to be talking about mobile healthcare services. Now, maybe you don't know a lot about mobile healthcare services, and you'll be wondering what it is about and why one even needs to have mobile healthcare services. And so this afternoon, with a huge round of applause, let's welcome Dr. Akwe. Welcome, Doc. How are you?
Nice meeting you.
Nice meeting you. Please have a seat. And of course, please have a seat as well. So we're waiting for, you to dance, but unfortunately you didn't get to dance. It's
I was
fine.
waiting for the music.
No, we'll give you the song after. It's
All right, okay.
I mean, better late than never, is it?
I can't wait, yeah.
Yeah, so we'll be dancing. So Dr. Awa says that you should actually reserve his song for, when he's about to leave. What song do you want us to play for you?
I chose Bob Marley.
You want Bob Marley? Which of his songs?
I don't know.
Any of them? No woman, no cry. Is that the one you want?
That would be perfect.
That would be perfect. No woman, no cry. So we'll be playing that one for you.
No problem.
Or you want Is This Love?
No, that's okay.
No, you
That's
want the
fine.
No Woman, No Cry.
Yes, please.
He says he wants No Woman, No Cry. Doc, welcome here once again.
Thank you for
I hope
inviting me.
everything is fine.
Everything is wonderful. Thank you.
Great. And now you are into mobile health care.
Absolutely.
And, it's new in Ghana. Most people don't even know what mobile health care is when we talk about mobile health care. So tell us a bit about it.
Mobile healthcare it seems to be new in Ghana. But I'm from the United States, and I practiced there for 20 years. And I did the same thing in the US for years. So I've been back to Ghana for 5 years now. When I came, there was nothing like that. So I set it up. So we provide healthcare in the homes of patients. So looking like that, right? To see a doctor, usually you see a doctor face-to-face, maybe 15, 20 minutes.
Yeah.
Right? And then you prepare to see the doctor. It takes about hours and hours to get ready for your home, going in traffic, going queue, to see a doctor for just 5, 10 minutes, but for 50 minutes, right? But when you call us, we come to your home. Whether come to your home or your office, or wherever the emergency arises, we come there and we provide medical care.
So in case of emergency, we don't have to rush to the hospital. You'll be there within how many minutes are we looking at?
Usually within an hour we'll be there.
Okay.
Yes.
Right.
And we are on call 24/7.
247?
Yes.
So whether 1 a.m., 2 a.m., 3 a.m.?
Anytime you call
Anytime
us.
even the witches are operating your...
We operate with witches too.
That's amazing. And so, again, people will feel that if I go to the hospital, there are certain things that I might get access to, but I won't get access to a mobile doctor. Is this true?
Well, we are basically doctors on wheels, right? Most things that you get in the hospital, we can provide that in your home.
Like what?
Most things. For example, you are sick, you need oxygen.
Okay.
The nurse will stay with you. You need blood transfusion. You need IV antibiotics. You need IV fluids. All of them we can do at home. With blood tests, we come to your house, draw the blood, we take for the X-ray for the lab for testing. With ECG, we do all that. Except X-rays and CT scan, then we take an ambulance and take it to get it done and come back home. But most things that you can do in the hospital, we can do it at home.
So how is it better than us going to the hospital?
First of all, if you value your time and value that you want to be seen on an emergency basis and in a privacy, it's better to see us,
Okay.
to have a home doctor services. Because it's quick, right? And then you don't have to hustle to go to all the problems to the emergency room. And sometimes you'll not be seen early,
Yeah, even in the
right?
emergency
You may
room.
not be seen early.
Sometimes they
right?
tell you there's no bed.
Yes. For us, we have many beds, unlimited, because your bed is your house, right? So we come to you, bring everything that you need, and then we can take care of you.
I like the fact that you said even blood transfusion, you do all of that
Yes.
in your home.
Yes,
Wow.
everything.
Wow. I think that we've gone far as a country Because the services that sometimes we receive in the hospitals, it's even depressing that can take you to your early grave. So if we should call on our mobile doctor, are you going to stay on the phone with us, telling us what to do in terms of first aid till you get there? Or we just call you and, you have to come and take over at the time that you get there?
Well, most of the time you call us, we triage you first to see the severity of the problem. Then we gather our things, from the office, and we'll come there with the right equipment. Usually we are there within 1 hour.
Okay.
So once we triage you, we know exactly what the issues are. If you need oxygen, we bring oxygen. If you need a nurse, you can immediately. So whatever we think you need on the spot, we bring it along with you. So we triage you first, Okay. Usually you are home, you are helpless, you can't do much, right? You can't do much, So you wait till we arrive.
Another concern is maybe you don't have the records of the patient, and so sometimes you might administer the wrong drug. So how do you handle that one as well?
Because we are mobile, most of our records are actually on my phone.
Okay.
They're online. So most of the patients' records are online.
What about first-time patients?
First-time patient, we take the records in the house. So we do what we can do best. We go through your medication history. We speak to your family. If there are any healthcare providers that you were dealing with, we try and reach them and then see what they have for you. Most times, they don't cooperate. So we start from scratch.
Okay.
Yes.
All right, so you start from scratch. Do you guys have any questions? Because I told you that if you have questions, I'll come to you. So you have questions ready? Or you have a question, okay. So today we want to get very interactive because when it comes to mobile healthcare, a lot of people get a bit confused about it. And you at home, if you also want to send in your questions, you can send it to us on 055-157-5757, 055-157-5757. Yes, darling.
I want to know the branches that they have in Ghana, because most of the places that we have in Ghana, they don't have access to all these things. So are they countrywide so that people can get access to, or they are limited?
Okay, that's a good one.
Well, it's a good question. We've started about, say, 4 or 5 years ago. We are mostly in Accra.
Okay.
We do get calls to go to outside Accra, such as Koforidua, Akosombo, Sunyani, some like Kumasi. When such calls come, we accommodate it and we go, So yeah, we are gradually branching to other big cities, but currently we are heavy in Accra, and in future, as we expand and people get to know us, they will go to other cities as well.
Okay. So what healthcare services do you provide? You give the doctors, you give the nurses, and what else do you give?
So it's a general practice,
okay,
right? And general practice, we are mainly to give you the best of care. And most things are within our jurisdiction. Right? Most medical stuff, If it's surgical, if it's gynecological, then we know that, okay, this we cannot handle. Then we refer you to appropriate specialty care.
Okay.
For surgical stuff, we refer you. But most things we handle in the house.
Do you deliver babies at home as well?
Well, it was on our plan.
Okay.
We don't do it at the moment, but as we expand and we grow, it's something that we can consider.
Yeah, because people like to deliver their babies at home. I have that prayer, like, if I'm having more babies, I want to deliver at home, probably in a pool, and then you are in the pool with your family, and I heard movies such it. Yes, darling, you want to ask a question?
I want to ask that when it comes to medicine aspects, when the person is sick, will you write the medicine for the person to go and buy it? Or you'll be coming along with plenty medicine because maybe you wouldn't know what exactly the person is going through that moment?
Yes, so we have what we call emergency medications, right? So when we move with all the emergency medications. When we get there and we think, oh, this needs a specialized medication, then we have a pharmacy that we call them and they will deliver it immediately.
Okay.
So we have all the medication. You don't have to buy any medication at all.
All right. Wow, that's nice. Yes.
First question is that I want to know how you deal with pranks, because somebody can be in his or her home and call you that, oh, I'm sick. But when you get there, maybe it's a prank. I want to know how you deal with that particular problem.
Right.
It was something I was scared of when I started this business in Ghana. In the US, it doesn't happen. And people will call us. Most calls we have are genuine calls. most of them, you know. We haven't come across that one yet. Maybe it may come up, you know. But I'm thinking that for us, if you call us that you are sick, you must be sick to call us, you know.
Yeah.
So it hasn't come to that point yet. Maybe one day somebody will call us a prank call.
So if it should happen, how will you handle it?
Well, I go there with an escort, with an escort. So if it's like a fight time, then the
escort will take over.
Take over. Hopefully,
Right.
that doesn't have to get there.
Yeah.
Yes.
Anyway, yes.
Okay. A question was asked: how long or how many minutes will it take to get to someone who is sick? And you said an hour. And my brother asked the question, and you mentioned Kumasi, which an hour is not possible to move from here to Kumasi. So someone calling from Kumasi, and an hour is not possible. Do you have any measures down for the person to, let's say, sustain the person or keep the person till you get there?
Currently, we are not taking emergencies in Kumasi.
Okay.
We are getting calls in Kumasi, Koforidua, Begro, for family members that are outside the country who think, oh, my grandmother had these problems, she can't go to the hospital, go and check on them.
Okay.
Then we go there and check. If we need to provide a nurse on the spot or a nurse to take care of the patient, then we send a nurse there to be with the patient, you know. But we're not taking emergencies from Kumasi. If we do call us and we think it's an emergency in Kumasi or other places that we cannot go within an hour, then we advise you to call the ambulance to take you to the nearest hospital.
Okay, that's nice. Yeah, any more? Yeah.
Please, I also want to ask the mode of payment.
I like that one. The mode of payments is another thing that people will be wondering, you know, can we afford such a service?
Well, looking at this, you know, health is the most expensive commodity on earth, right?
Mm-hmm.
I mean, our pricing is not above board. It's comparable to other high-end centers
Okay.
in Accra, right? But the advantage is that we come to you. You don't go to, you don't come to us, right? So for pricing, I think we are very, very competitive.
Okay. So do we have to pay for your transportation for coming to us?
Everything is inclusive in the consultation.
All right.
Right.
And do you take the money usually before you take care of the patients? Because some of the hospitals, that's what they do. And when you can't raise the funds, then unfortunately, you lose your loved one.
Well, we're not too hard on pay me first,
Okay.
right? Because most of the people that we have, they are honest people, right? They pay us after the service is delivered. So we don't usually come across cases that they won't pay us, you know. So we provide services, we send an invoice, and you send us a memo, or you can pay us on the spot if you want to. But most people that we see, they are honest. We don't chase them. They just send the money to us. You know?
Okay, that's nice. And so, you know, more people are concerned about, you said you do general practitioner.
Yes.
That's what you do. So how soon are we going to have the specialized doctors coming on board? Because people who are watching want to know how they can get the specialized doctors.
Well, looking like this, you know, when it comes to like highly specialized areas like ophthalmology, like dental, they use equipment.
Okay.
Right? And those equipments cannot come to the house. So when it comes to the complicated cases, then we advise you to go to the hospital.
Okay. So you recommend a doctor to them?
Because we have a link of specialists that we use in our practice.
Right.
So we refer to one of our partners, you know, and they will take good care of you.
So since you started this business, have you seen or have you experienced any form of challenges in Ghana? Our market
Yeah,
system?
it has been. There have been a lot of challenges in Ghana.
Like what?
First of all, it's a new product in Ghana, right? So we had to do a lot of advertising to be known, right? And the one big challenge also is that patients don't have the education about being proactive in their care. For instance, if I see you today with an acute problem, like severe hypertension, diabetes, complications, and I see you under normal circumstances, you have to be seen every month, every 2 months after you've recovered. But most people will tell you that, oh, I'll call you when I need you. That is not good. And that is a big challenge in Ghana, you know, because when they need you, then it's
That's
too
when they
late.
call you.
Right? And it's too late. They don't call you. When they are fine, they are fine. And that's why we see so many early deaths in Ghana, you know.
Right.
A lot of people are walking in the streets with so many problems. They don't know that they have it until they have a stroke, heart attack, or they have sudden death in bed, you know. So if, you know, that proactivity is not there in Ghana, and that's a big challenge, you know. So those are there are other challenges that I could go on and on, but those are the big things that people have to take their life, their health in their own hands and be proactive. It's difficult to die
Yes.
unless you want to die. If you want to die, then don't do
The right thing.
the right thing, right? Dying is hard.
Right. Any questions?
One of my colleagues spoke about Frank, and for mobile doctor to be accepted, the people out there, they have contribute to it. Do you have something to tell the view contribution to better mobile?
Can you repeat your question again?
My question is, do you have something in mind that you want to tell our viewers that they can do to contribute to the to better mobile banking, mobile doctor?
Yes.
You know, I think that what you can do to contribute is to let people know that we exist. Because when we go to a home, oh, we didn't know you exist.
Yeah.
Right? So let people know that, oh, there's mobile doctor service in Ghana. Just go on the website, Google mobile doctors, right? And you'll find out about numbers and everything, you know. So what you can do is let people know that there is this service in Ghana.
So, but do you have enough doctors that, let's say, you have about 10 emergencies, you can serve all 10?
We employ doctors as well. We have about 3 or 4 doctors
Okay.
we're working with.
Okay.
Know? And it's enough for Accra for now.
Yeah,
You know?
yeah.
Because we triage them. If an emergency, we make a priority, you know. So when we get that point, we hire more doctors.
Okay. That's good. Yes, you want to?
I want to know the measures you have put down to resolve this scammers then fraud, because someone can just call you and say, I'm the manager of the doctrine, online doctrine. I want to come and help you. You send them the money then.
Yeah.
Because Ghana, everything is a scam.
I mean, it's so true. Let me share my experience. I actually was buying pizza some time ago, and it was, what's the name of this pizza company?
Papa's Pizza.
No, it's not Papa's Pizza,
No,
the other
I
one.
was.
Pizza Man. Pizza Man. And I went on Google, picked a number, and I called the person, said, yes, oh, which one do you want? I said what I wanted. They gave me the price. I should pay via Momo. I paid the first one. They said, oh, the money didn't come, pay again. So at a point, I realized it was a scam. So I stopped. Only for me I kept on waiting for the pizza to be delivered. 2 hours, nothing was delivered. So I sent somebody to the branch, and they said it's a scam.
Yeah, so I've had the same scam before myself, pizza, you know. But we bill you after we've done the services.
Okay.
Right? We see you first, we send an invoice.
Okay.
So
Okay, that's
there's
good.
no way that you send the money to the wrong person.
That's a good one. What if you send us the bill and we can't pay?
Oh, we help you to pay. I mean, we're not practicing to extort money from people. You know, we look at the circumstances.
Okay.
You know, we come to you. These are our charges. You know before we come anyway. You know, these are our charges. If you can't pay, you give a payment plan.
Oh, you give payment plan?
Yes.
Wow, give them a round of applause for that one. Wow. Then you are doing more of charity work.
Well, I've done charity work for years and years and years across the world, you know, in the US. So, yes, I came to Ghana to practice medicine as a retired doctor, right? So what I'm doing now is to introduce service, you know. I want a lot of doctors to take on it and do it, you know. So, yeah, we've done a lot of charity work before. People don't pay us, we write it off, you know. So, yeah, you can't have it all in medicine, right? Because some of our services are not paid for.
So you're on social media as well?
Yeah, we're on Facebook,
Okay.
we're on YouTube, we're on Instagram, you know, a website.
Okay.
Yeah, so
That's
you
nice.
Google us and you see mobile doctors will come first, you know.
All right, Dr. Awa, thank you so much for sharing this with us, because for me in particular, I think I'm going to put your contact in my contact list, and anytime I need you, I'll call on you.
Absolutely. We're waiting for your call.
Thank you so much for being here. We are very
All right.
grateful.
Thank you very much.